Back to our race for a vaccine coverage. The vaccines are out, but will you get it? Recent studies show the black population is more hesitant than other groups. To find out why, I spoke with Dr. Malcolm John, a professor and expert in infectious diseases at UCSF.
Well, I think there's several reasons. Number one is historical distrust of the healthcare system. Of course, people reference Tuskegee and others. I think it's also a lack of access to healthcare, kind of compounded over time, less communications about the importance of vaccines, less communications around understanding people's experiences of side effects and what those side effects mean, that in fact they may mean the vaccine's actually working. I think so that sort of long-acting trust. I think it's also important to have the appropriate messengers. Again, I spoke earlier about setting an example, but I think it's really to have trusted sources of information. How well does the community trust who's bringing that information to them? And I think all communities really are shocked, and we're really amazed at the speed of development of this vaccine. I think at the same time that causes people to have natural pause.
So why should we feel more comfortable taking this vaccine when it seems like it's a rush job? Great
question. And actually, the development of this vaccine has been going on since 2003, really, with SARS and MERS. So basically, at that time, the development of this platform of using small messenger RNA surrounded in lipids to deliver a vaccine was developed for those diseases and others like Zika and even the flu and even an HIV form that was more adenovirus based. So when the time came for developing a SARS-CoV-2 vaccine, the platform was already well along and being promoted for other disease states. So it was a matter of an opportune time. We were prepared, and we're very lucky and fortunate.
Dr. John also says side effects usually appear 6 to 8 weeks after vaccination. So by the time the general public, like us, gets vaccinated next spring or summer, we'll have a lot more data because millions of healthcare and essential workers will have been vaccinated by then. The vaccines have also been thoroughly reviewed by doctors, experts, and the FDA. Dr. John says he can't wait to get vaccinated when it is his turn.